Welcome to Normal to Formal Podcast, episode number 22. I'm your host, Tia Young. I'm the founder of Tia Young Image and Etiquette. I help my clients learn the soft skills for success through professional development and etiquette training. This podcast is for people that want to increase their social skills and earning potential and grow from normal to formal. These skills will help you get ahead of the competition. The topic for today's podcast is funeral etiquette, especially during COVID-19. I'm referencing information from the CDC, which is the Center for Disease Control and Prevention. They have an article called Funeral Guidance. Grieving the loss of a loved one during the fear and anxiety about the COVID-19 pandemic can be overwhelming. It may be difficult for people to make decisions about how to safely grieve and honor their loved ones. This guidance is for individuals and families as they work with funeral directors, community and religious leaders, and others to plan and hold funeral services and visitations during the COVID-19 pandemic. Help lower the risk of spreading COVID-19 by following some simple guidelines. I wanted to do this podcast because over the last few weeks, I've had several family and friends that passed away from COVID-19. And for me, I'm not comfortable right now going into those settings of the funeral in person. But there are guidelines to follow for those that do. The following are the guiding principles. The more people interact, the closer in distance the interaction is, less than 6 feet, and the longer the interaction lasts, the higher the risk of spreading COVID-19. The higher the level of community transmission in an area, the higher the risk of spreading COVID-19. Masks help lower the risk of spreading COVID-19, particularly if social distancing cannot be maintained. During an in-person gathering, convene in outdoors or in well-ventilated areas if possible, rather than poorly ventilated indoor areas to help lower the risk of spreading COVID-19. Outdoor gatherings are safer than indoor gatherings. Avoid sharing commonly used objects such as religious aids, example, religious books, collection plates, programs, etc., to help lower the risk of spreading COVID-19. Reducing the number of people who are engaged in activities like singing or chanting, as these behaviors can increase the amount of respiratory virus in the air. Just by singing, can you believe that? Practice increased hand hygiene and cleaning and disinfecting of frequently touched surfaces and objects to help lower the risk. Practice social distancing by maintaining at least 6 feet between attendees, facility or lay staff, and clergy or officiants, especially when small in-person services are held. Take extra precaution for those at increased risk, particularly those who are older or have pre-existing conditions, to help lower the risk of spreading the disease. I love my family dearly. My mom and dad I go to visit, but I don't visit as much as I would like because they're older, of course, and I don't want to spread anything to them because of maybe weakened immune systems. The risk of COVID-19 spreading at gatherings and services is ranked as follows, from lowest to highest. Low risk, virtual only services and gatherings. So that's the best way to attend a funeral service, virtually. Lower risk, smaller outdoor in-person services and gatherings in which individuals from different households can remain spaced at least 6 feet apart, wear masks, do not share objects, and come from the same local area. Example, community, town, city, or country. Higher risk, medium-sized in-person services and gatherings, either indoor or outdoors, adapted to allow individuals to remain spaced at least 6 feet apart, with some individuals wearing face masks and with some attendees coming from outside the area sharing or objects is limited. And the highest risk, large in-person services and gatherings held indoors and where it's difficult for individuals to remain spaced at 6 feet apart. Many attendees travel from outside the local area. Few individuals wear masks and objects are shared. So that's the highest risk, and that's the one we want to avoid most. Protect yourself and protect others. Many times people will have the COVID-19 virus and not even know, be asymptomatic. So make sure that you always wear your mask when you're outside of your home. In some situations, many people have become sick with COVID-19 after attending a funeral service. To help prevent the spread of COVID-19 in communities, changes need to be made to the way funeral, visitations, and memorials to the deceased are held. And these guidelines provide strategies to protect yourself and others when you are grieving the loss of a loved one, supporting each other, making funeral arrangements, and participating in funeral services and visitations. It's already a very difficult time for people, so you want to take precautions when you do so. Some of those examples are using technology to connect virtually with family and friends during the grieving process, considering modified funeral arrangements such as limiting attendance at funerals held during, shortly after the time of death to a small number of immediate family members and friends, and then holding additional memorial services when social distancing guidelines are less restrictive. Practicing social distancing by maintaining at least 6 feet between attendees, facility staff, and clergy or officiants when small in-person services are held. Considering modifications to funeral rites and rituals, for example, avoiding touching the deceased person's body or personal belongings or other ceremonial objects to make sure of everyone's safety, and wearing masks while around others and outside of your home. I live in the Tampa Bay area, and one of the funeral homes that I have visited the most is the Ray Williams Funeral Home. And that funeral home has on their website COVID-19 information. And one of the things that they listed on their page concerning COVID-19 is to slow the spread of COVID-19. They state, in an effort to ensure the health and safety of our families and do our part to limit the spread of the coronavirus, the owners and staff of a Ray Williams Funeral Home have adjusted the visitation hours from 5 to 8 to 3 to 7. What they have done is extended the visitation because they want more people to be able to visit, but only 10 people can be in the room at a time. Extending the visitation hours will allow additional time for family and friends to pay their respects. Back to the CDC guidelines. Grieving the loss of a loved one. Grief is a normal response to losing someone important to you. When a loved one dies, it is important for friends and family to be able to share stories and memories of the person and how they influenced their lives. The COVID-19 pandemic has affected the ability of friends and family to come together in person and grieve in typical ways. This is true regardless of whether the person's death was due to COVID-19 or some other cause. Given the COVID-19 pandemic, hosting gatherings now could be dangerous to those who would want to participate. Family and friends are finding alternate ways to connect, support each other, and grieve after their loss. They understand the need to possibly plan for additional memorial services when COVID-19 related restrictions are lifted. Many funerals during the service, they give an opportunity of family and friends to come forward to speak. There need to be other ways of being able to do that. Take action to help you cope with the loss of a loved one. Grief is a universal emotion, but no two people experience grief in exactly the same way. Some actions you can take to help you cope with feelings of grief while practicing social distancing and honoring your loved one. They include invite people to call you or host conference calls with family members and friends to stay connected. Just recently, I lost a good friend that was part of an organization that I belonged to, and the members of the group held our very own virtual memorial service for her in her honor. And we also decided to help out her family in some way and her daughter. Another example would be ask family and friends to share stories and pictures with you via phone, video chat, email, text message, photo sharing apps, social media, or mailed letters. Create a virtual memory book, blog, or webpage to remember your loved one, and ask family and friends to contribute their memories and stories. Coordinate a date and time for family and friends to honor your loved one by reciting a selected poem, spiritual reading, or prayer from within their own household. Seek spiritual support from faith-based organizations, including religious leaders and congregations. Use grief counseling services, support groups, or a hotline, especially those that can be offered over the phone or online, or seek support from a mental health provider. Never be afraid to reach out for help. Read books about grief and loss. Take part in an activity that has significance to you and the loved one you have lost, such as planting flowers or a tree, or preparing a favorite meal in memory of your loved one. During the COVID-19 pandemic, the family and close friends of a person who died of COVID-19 may experience stigma, such as people avoiding them or rejecting them. Stigma hurts everyone by creating fear or anger toward other people. Some people may avoid contact with you, your family members, and friends when they would normally reach out to you. You can help stop stigma related to COVID-19 by knowing the facts and sharing them with extended family, friends, and others in your community. If you are the one making the funeral arrangements, keep these things in mind. COVID-19 does not need to affect whether the funeral takes place through burial or cremation. Wishes of your deceased family member or friend may continue to be honored. In general, there is no need to delay funeral services and visitations due to COVID-19. However, some changes to traditional practices are likely needed. Family members may need to discuss timing of services with funeral service providers who may be overwhelmed. COVID-19 is a new disease, and we are still learning how it spreads. There is currently no known risk associated with being in the same room at the funeral service or visitation with the body of a deceased person who had confirmed or suspected COVID-19 after the body has been prepared for viewing. So keep that in mind. There is no known risk associated. Take precautions when planning and holding funeral services and visitations to prevent the spread of COVID-19 among those in attendance, including those who may not have symptoms. And of course, remember to practice social distancing while making funeral arrangements also. Do not attend in-person meetings if you are sick or if you may have been exposed to COVID-19. Those who have higher risks of severe illness should weigh the benefits of in-person attendance against risk of exposure to a person with COVID-19, especially if recommendations for wearing masks and social distancing may be difficult to follow for themselves and others. So discuss options for making changes to traditional funeral plans. Traditional funeral plans, you can pack the room with overflowing people seated and standing. But now we can't do that. We have to be 6 feet apart. We have to limit the amount of people in the room at a time. We have to wear masks. We have to use hand sanitizer. Ask the people you're working with, the funeral home, staff, clergy, or officiant about resources they may be available to provide, such as virtual funeral services, visitations, and memorial tributes by online video, streaming, or recorded video.